So I want to say that the presentation is quite diverse, and it if to really understand sleep apnea and to see if someone has sleep apnea, what you would want to focus in on are those things that are specific to sleep apnea. And here I'll give you a list of those that are really specific to sleep apnea. They're associated with sleep apnea very commonly, and you can depend on them to give you a hint of whether or not someone has sleep apnea. The first one won't surprise you. That's snoring. Pretty much everybody, but not everybody, but pretty much everybody who has sleep apnea snores. You ask them, do you snore? And they'll say yes. Well, chalk that up. That's one symptom that we certainly can rely on. Another one is high blood pressure. Do you have high blood pressure, or have you ever had high blood pressure? Even if it's treated with a drug, you are a person who has high blood pressure, has had high blood pressure. That's another tight associate. So it's something we look for when we're trying to figure out clinically whether someone has sleep apnea or not. A third one is being overweight, and that's a common one, and particularly you can relate it to a large neck. So if someone has a large neck, a circumference of 17 inches or so, that's a predictor of sleep apnea. And then finally, if you ask someone, do they awaken in the night, gasping and choking? That's another predictor. So if someone can tell you, oh, I wake up at night and I feel as though I can't breathe, I'm gasping and choking, you can take that as a sign or symptom of sleep apnea that would be predictive. You put all those together, actually, it's the high blood pressure, snoring, awaking, gasping, and choking, and a large neck. Those things do pretty well. And if you have all those, you probably got sleep apnea. There's probably 80% or more chance that you have sleep apnea. So those are the symptoms that are pretty tightly associated, but then there's a myriad of others who are related but may or may not be caused by the sleep apnea. Clinically, this is a problem that we face all the time. A person will present with the symptoms that I first talked about that are tightly associated, and then you diagnose them as having sleep apnea, and you want to know whether other symptoms that are not so tightly associated with sleep apnea, whether they're going to improve when you treat the sleep apnea. Well, that's a very tough thing to predict. For instance, someone has migraines, someone has chronic fatigue, depression. You can have a lot of these things, and they may or may not be caused by the sleep apnea. And you won't know actually until you treat the sleep apnea, eliminate it, and then you can see if these symptoms went away. So it is quite common that someone with sleep apnea will be depressed, but depression by itself is a common problem, and just because it's associated with in the same setting with sleep apnea does not mean that the sleep apnea is causing it. It isn't until you actually eliminate the sleep apnea that you can then find out whether or not some other problem is caused by the sleep apnea. But you can bank on things like snoring and gasping and choking and high blood pressure. If you have those, when you treat the sleep apnea, those will go away.